To that flu crisis, it's growing across the country, and the CDC already calling this year's outbreak an epidemic. At least 15 children have died.
Right now, many states across the country are on high alert because of that. And right here in Michigan, the CDC calling the number of cases moderate.
The Now Detroit's Jane Park is in Pontiac to tell us why the flu may be especially dangerous this season.
Emergency rooms and urgent care centers across Metro Detroit say they're seeing a lot more flu cases, and a lot of the patients have actually already gotten the vaccine. But unfortunately, it's just not a good match for the kind of flu they're seeing.
We have seen a marked increase in the flu starting even in November and late October.
Emergency room Dr. Raul Mehta of St. Joseph Mercy, Oakland, says the flu has been especially bad for the elderly and young children. Already 15 children have died nationwide from flu complications. The Centers for Disease Control and Prevention now calling the illness an epidemic, with the most widespread activity in the Midwest and South. Hospitals in southeast Michigan are taking extra precautions too. Children's Hospital and Beaumont are not allowing young children to visit inpatient units. Why is this flu season nastier than usual?
The vaccine has not been that effective.
Experts say most of the flu cases they're seeing are influenza A, the H3N2 subtype, and it's associated with more hospitalizations and deaths. The vaccine is still your best defense, doctors say. Though not as effective this year, it can still provide some protection. And that's good, considering we don't know if we've seen the worst of the season yet.
We're hoping that it's peaked, but, January and February, it's hard to know what the rates will be back then.
The flu will typically run its course within 3 to 7 days, and doctors are urging you to be responsible. Keep your kid home from school or stay home from work if you're experiencing any symptoms. In Pontiac, Jane Park, the Now Detroit.